Hello everyone. In this video, we are going to practically demonstrate the best median nerve mobilization exercises that can be utilized to treat carpal tunnel syndrome condition. In carpal tunnel syndrome, as we all know, there is pain, discomfort in the wrist and around the lateral portion of the hand. Often there is pain along with paresthesia and numbness, and chronic conditions can also cause wasting of the thenar eminence. So in this particular video, we are going to see how by doing some very specific median nerve mobilization exercises, we can reduce the compression around the median nerve, as well as we can bring down the swelling and improve the conduction of the nerve, thereby helping in easing off the pain and other symptoms. So let's get started. In patients who have significant compression and discomfort, and in those patients who have abnormal NCV findings, we can start by decompressing the nerve using the taping around the palmar aspect of the wrist crease. So what we have to do is we have to just bring the thenar and hypothenar eminence together and tape this particular position of the wrist and hand. This creates the space around the nerve, thereby decompressing it and making it less sensitive and therefore more tolerable to exercises. So after we have taped the wrist, we are going to ask the patient to sit beside a couch and just stack some pillows under the arm region so that the shoulder is almost 90-degree abducted. And in this particular position, we will ask the patient to roll out the arm into external rotation and keep the elbow extended if possible, if patient has no significant stretch here. Otherwise the elbow can be kept semi-flexed. The wrist and hand are going to be in flexed position. So this is our starting position. Now from here, the first exercise is going to be where we are going to ask the patient, just open up your fingers and wrist in the downward direction and at the same time bring the head so that the ear moves towards the shoulder. And you don't have to feel any discomfort or stretch during this particular exercise. And then come back to this original position and move the head and neck to the opposite side. And perform this exercise for about 15 repetitions. After you have done this exercise, start by only moving the wrist and hand region where you open up the wrist and hand and move to the first point of discomfort and come back. And perform this for another 15 repetitions. It has to be remembered that there should be no significant pain and discomfort during the performance of the exercise, and we stop at the first point of stretch or discomfort. In the next set of exercise, we are going to ask the patient to move the head and neck away in this particular position and back to the neutral position. And this has to be performed again for around 15 repetitions. Position of the elbow can be kept slightly flexed in patients who find the exercise less tolerable, because adding flexion makes the exercise easier for the patient. As you start improving, you can increase the amount of elbow extension. For the next set of exercise, we are going to ask the patient this time to open up the wrist and hand and move the wrist down into extension. Feel some tension in the nerve, hold it for around 1 to 2 seconds and come back to the starting position. So this time we are actually going to produce some stretch in the nerve, and we are going to hold that stretch for around 2 seconds before coming back to the starting position. Perform this exercise for another 15 repetitions. And in the last set, we are going to perform the exercise where we are going to stretch the nerve from both ends, where the wrist goes down into extension and the head and neck moves towards the contralateral shoulder. And we perform this for 15 repetitions. Once you start feeling better in the subsequent sets, that is, maybe if you have performed this in the morning, then in the afternoon, you can do this with the tape off. Keeping the tape off, will allow you to progress further and have better results with the exercises. Remember to have the tape on only when the symptoms are severe. Perform these exercises along with the other carpal tunnel exercises on which we have made a detailed video, and we have also received very good feedback from many of our viewers. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.